Situation in Saskatchewan now too, because many are saying that new public health measures in that province don't go far enough. Dr. Alex Wong is a well-known face to many Canadians now, an infectious disease physician in Regina. Good to see you, Dr. Wong. Appreciate you being here.
Morning, Rosie. Thanks for the opportunity.
I may talk to you more broadly about the situation out west, but I'm going to start getting your reaction to some of the policies that were reintroduced by Saskatchewan at the end of last week. Some people believing that they probably didn't go far enough. What's your thought?
Yeah, I mean it's barely a start. I mean, Friday previous, the our neighbors next to us instituted at least an indoor public masking mandate. And not a whole lot else. There was an incentive that didn't do a whole lot for vaccinations. We didn't even put a mask mandate in place. I mean, all we did was basically reinstate, the need to isolate essentially in a mandatory fashion if you have COVID-19, which was rescinded back on July 11th. So again, I mean, there are clear recommendations that have been made by our public health officials from over 2 weeks ago that we really need the government to act quickly on before our ICU capacity is overwhelmed.
I talked to the mayor of Saskatoon last week because he was doing sort of what the mayors of Alberta in Alberta are doing, just pleading for more. And I must admit, I was fairly stunned that there was no provincial mask mandate, because it does seem to be sort of the one piece of science that is pretty easy for everybody to do. And I wonder why you think that there is such reluctance to go back to that.
At the end of the day, we've always looked at masks as essentially almost a zero risk, all benefit intervention. And, one of our local reporters at the end of last week sort of, again, highlighted the fact that there was internal modeling that the government has had access to that shows that a universal mask mandate across the province could reduce community transmission by upwards of 50%. And that could have a huge impact on our hospital and our ICU capacity, which is already basically at the brink from our critical care perspective. And so when the science is there, the modeling is there, the evidence is there, and when we're at the brink, the only explanation, frankly, is that there's some other overriding motive, for our provincial government, which again, I can't speculate on, but that clearly is overriding what it is that, a mask mandate would be, whether it's symbolic, political, or otherwise. But honestly, for me personally, it's extremely frustrating.
CBC also learned this week that the Provincial Health Authority plans to slow down and pause certain work in hospitals. We know that that is sort of what you do to prepare for an influx of patients. Can you give us sort of an idea of what it's like in hospitals and what you fear might be to come?
Yeah, so I mean, I'm down here in the south in Regina, and we got nailed with the third wave basically and got crushed. We're in a situation now where it's central and northern Saskatchewan, especially Saskatoon, to the north, which is getting crushed. And so unfortunately, again, we are a big province, but we don't have a ton of overall capacity. So, critically ill patients basically from central and northern Saskatchewan have been on bypass down here to the south for essentially the last couple of weeks. And we're already at sort of capacity in terms of where we're at, and things are just going to continue to get worse. So, from a hospitalization and ICU perspective, it is pretty grim. We're very much just kind of following the same trajectory as Alberta, which has gotten a lot more attention, but we're looking at the reality of ICU and medical triage now and having to decide again, maybe in a matter of, a couple of weeks as to sort of who is going to live and who is going to die. And that's just a tragic situation to be in. And we're desperately trying to, again, push for measures like masking, like vaccination certificates and passports to help, get us out of this as quickly as possible before we have to triage lives.
With school back too, I know that the 4 largest school divisions in the province have already reported dozens of cases among students and staff. Some of that you would expect, I would think. I don't know whether people are masking in schools. How concerned are you about the situation in schools and that leading to further community spread, particularly amongst those who aren't or can't get vaccinated yet, young people?
Yeah, I mean, it's a real concern. I mean, we have essentially uncontrolled, unchecked community transmission occurring pretty much throughout all of central and northern Saskatchewan. And so when you have that going on and essentially no test trace isolate in place, no sort of adequate access to testing in place. Again, people are literally waiting hours in lines, and drive-through lines are closing before noon every day because we just don't have capacity and there's so much demand. That inevitably means that there's going to be huge transmission that's going to occur in schools. And unfortunately, for daycares and schools, that probably means closures because we just can't, willingly allow, everybody in schools to get COVID. So there's inconsistent masking at this point. Again, one of the clear recommendations by our public health leaders has been universal indoor masking in schools. That definitely must happen across the province.
So you think, and I'll just end on this, Doctor, you think that there will be like maybe versions of lockdowns still in Saskatchewan, maybe not in businesses, but certainly in schools and in other places?
Truthfully, Rosie, I'm not actually even really sure what to say at this point. Like, again, I mean, putting something like a mask mandate to me as a physician seems so simple and so easy and so obvious, and yet it didn't happen. So I'm not really sure at this point exactly what will happen, but I know that, we need to essentially try to do everything possible at a policy level in order to avoid the reality of ICU and medical triage and trying to, again, avoid that reality. So I'm certainly hopeful that the provincial government will move forward aggressively. At the same time, I'm also realistic. Like, it's a difficult situation, and I'm not really sure at this point what it's going to take for our provincial government to see the light and do what's necessary.
Dr. Alex Wong, I know you took time out away from your family to be with us today. I know you've got 2 weeks ahead inside the hospital, so be well, be safe. Thank you for making time for us.